Hookworm, Nicator americanus, a presentation by Manuel Chavez, Yesenia Astorga Gonzalez, and Josh Robert.
Overview. Scientific name, Nicator americanus. Domain, Eukaryota. Family, Ancylostoma. Kingdom, Animalia. Order, Rhabditidae. Phylum, Nematoda.
Description: the Nicator americanus is a small, thread-like parasitic worm measuring 10 to 13 millimeters in length, commonly found in contaminated soil. Epidemiology: the Nicator americanus is prevalent in tropical and subtropical regions, particularly in areas with poor sanitation and inadequate hygiene practices. It is estimated that over 400 million people worldwide are infected with Nicator americanus. Regions with high prevalence include parts of Africa, Asia, and North and South Americas.
Parasitic relationship. A parasite is an organism that lives on or in a host organism and gets its food from or at the expense of a host. www.cdc.gov. Parasite helminth. Nicator americanus. Host, humans.
Portal of entry and route of transmission. The portal of entry for the Nicator americanus is the skin, typically through direct contact with contaminated soil. The route of transmission occurs when the infective larvae penetrate the skin, usually through bare feet, touching with contaminated soil or walking on contaminated surfaces.
Life cycle of the intestinal hookworm. Number 1, eggs are in feces. Number 2, rhabdiform larva hatches. Number 3, development to filiform larva in the environment. Number 4, filiform larvae penetrate the skin. Larvae can become developmentally arrested and dormant in tissues. Reactivated larvae may enter the small intestines. Larvae exit the circulation in the lungs. They are then coughed up and swallowed. Risk factors: school-age children, walking barefoot outdoors in public areas, parks, grass, soil.
Affected organ systems. The Nicator americanus primarily affects the small intestine of humans. The adult worms attach to the intestinal wall, feeding on blood and causing damage to the mucosa of the small intestine. Signs and symptoms. An infection with the hookworm commonly presents itself as asymptomatic. The infection normally includes pain, nausea, and anorexia due to attachment to the intestinal wall. Itching and localized rash are common at the infection site. A severe infection can lead to iron deficiency anemia, occult blood and stool, and protein malnutrition. This is a prominent feature due to the blood-feeding nature of the hookworms. Although common signs and symptoms of a hookworm infection are non-severe and non-life-threatening, when a case of an infection goes unreported or undiagnosed or unknown, the Nicator americanus infection can lead to significant morbidity, primarily due to chronic blood loss and resulting iron deficiency anemia. Although rare, severe infections can lead to complications such as protein loss, malnutrition, and impaired growth and development, particularly in children. Mortality rates associated directly with Nicator americanus infection are generally low except in cases of severe anemia in vulnerable populations. That is why, if you suspect some sort of symptoms, as mentioned previously, report it to your doctor and try to take the proper measures to become diagnosed with the infection. Diagnostic methods. The diagnostic method used to diagnose an infection of hookworms in the body is through the use of a stool sample. A patient suspected with a hookworm infection needs to provide a stool sample to their healthcare provider. They then send the sample to the lab, where a lab technician will examine the sample under a microscope for eggs or larvae. They look at the stool sample for eggs and larvae because fecal matter is how the helminths spread. And when the eggs and larvae are detected in the stool, it is known that it is a positive diagnosis for a hookworm infection. Treatment. The primary treatment for Necator americanus infection is the use of an antiparasitic medication, typically albendazole or mebendazole. These medications work by inhibiting the growth and reproduction of the worms, eventually leading to their expulsion from the body. The treatment is typically effective in 1 to 3 days. Prevention. Preventative measures for Necator americanus infection include practicing good hygiene, such as regular hand washing and avoiding direct contact with the contaminated soil. So wearing shoes or sandals when walking outdoors is a must, and avoiding skin-to-skin contact with potentially contaminated soil. Improved sanitation, proper disposal of human waste, and health education are essential in reducing the transmission of Necator americanus. Thank you.